Bonjour everyone, my name is Jill Andersen and I work for Red Lake Comprehensive Health here at the hospital. I've been providing some updates on coronavirus, and today I'd like to discuss what to expect if and when it reaches our borders. So far, we've been lucky enough to not have a positive test here on the reservation. If we look at probability, however, we're pretty sure at some point it'll happen. Now, a few things about this. First, our goal as a reservation is to support the people that contract the virus. It was nothing they went looking for. They didn't do anything wrong. Anyone can catch this and anyone can pass it along to the next person. So rather than play the blame game, it won't solve or change the outcome. Let's pull together all of our members, workforce, caretakers, and show some solidarity and help get them through it as quickly and painlessly as possible. We've spent all this time preparing and educating ourselves so we would be ready when it happens. So when it does, let's support one another in the fight. Part of that fight is going to involve something called contact tracing. I've put out a few Facebook posts regarding this, and it's been talked about in the media, but it's still something many people have questions about. Sounds kind of invasive, someone asking you everyone you've been in contact with for an extended period of time over the past several days. Please trust that there is science behind this. The reason for contact tracing is to try to break the chain of passing along the virus. We want to keep it a controlled burn instead of it turning into a wildfire. Red Lake Comprehensive Health, Red Lake Hospital, and the Tribal Council have worked out a process for our area. We're also working together with the Minnesota Department of Health, so there's the possibility you could be contacted more than once. During the upcoming months, if any health authority tells you that you've been exposed, please follow their directions. Even if a family member or friend tells you that you've been exposed, you can call the Red Lake Contact Tracing Team for guidance and to answer questions. So it's important that when you get tested, you make sure you have updated phone or contact numbers, a street address if it's different from your mailing address, and the county you reside in. This helps streamline the whole process. So the first thing to happen if you test positive, you'll get specific guidelines from your doctor or nurse on how to monitor your symptoms. Remember, most of us won't have serious enough symptoms to require a hospital stay, only about 20%. So that means 80% of you should be able to just recover at home. Behavioral health or one of our wellness specialists will reach out to you and your family to address any stress, fear, or anxiety you might be feeling about testing positive or being around someone who did test positive. This won't just be available to the patient, but the family, caregivers, and other contacts as well. There's a Red Lake COVID hotline you can call for additional resources, including assistance with meals, childcare, or elder care. You'll get instructions on what to watch for with your symptoms while you're infected, if you have any, and we'll give you a way to reach us in case they get worse and we feel you need to be admitted to the hospital. So now for the contact tracing part. We'll ask you who you've had contact with 2 days before your symptoms started, not the testing date. Now, if you had no symptoms, we would have to use that testing date. So think back. Who have you had extended close contact with in the past 48 hours? Who could you have possibly exposed? These are things to start thinking about, making a mental note of in case you develop a cough or fever in the next 1 or 2 days. It's also the reason to continue to practice social distancing even as businesses start to reopen. You decrease your risk and the risk of everyone around you. So you want to be prepared. Even if you're not infected, you might be called because you were named as a contact. This can happen more than once depending on who's testing positive. So you will not be informed of the person's identity that named you, and your name will not be shared with others we're interviewing. Red Lake's a small community and we want to try to protect your privacy as much as possible. Keep in mind, the goal of this is to protect our families, our friends, and the community as a whole in order to try to contain the virus and keep it from spreading. We want to help connect people to the care and resources they need right here in Red Lake. The next step in the tracing process is going to be the education to the patient and the contacts according to CDC guidelines on what to do next. So the infected person is going to isolate. Isolation is used to separate people infected with the virus who may or may not have symptoms from people who aren't infected. So if you're in isolation, you should stay home until it's safe to be around others, and you'll be told when that is. It's on a case-by-case basis. In the home, anyone sick or infected should separate themselves from others by staying in a specific sick room or area. You want to wear a face covering if you need to leave the room, have your own designated water and eating utensils, and if you can, use a separate bathroom. If you can't, disinfect a shared bathroom. This includes the toilet and any high-touch areas after each time you use it. Contacts with the infected patient will do something called quarantine. Quarantine is used to keep someone who might have been exposed away from others. So it helps prevent the spread of the virus that can happen before a person knows they're sick or if they have the virus without feeling symptoms. So if you're in quarantine, you should stay home, separate yourself from others, monitor your health, and then follow directions from your state or local health department. If you then become symptomatic, inform the contact tracing team and we would consider testing. If you're positive, contact tracing would continue for you. This is how we stop the snowball effect. If you've been quarantined for at least 2 days before you have symptoms, the number of people exposed should be very low. It's important to remember that a negative test does not necessarily mean you're all clear. The virus could be in its early stages and not detectable yet. It's best to assume you have it during the quarantine time frame and then act accordingly. So both positive patients and contacts would stay home except to get medical care, separate from other people and pets in the home, and then watch for symptoms, and this includes fever and breathing difficulty. We can't give a general guideline right now on exactly how long you'll have to isolate or quarantine. It's dependent on your particular case and symptoms at the time. You'll constantly be updated and informed on what the plan is by the person assigned to your case, and you'll be given a number to call us if you have any questions that come up over this time. So it's worth repeating. Let's not give in to blaming and shaming or calling out somebody for being the so-called ground zero on the reservation. Let this be our time to recall all the good deeds we did and how we came together to fight it. Miigwech.